Well, thank you very much for your discussions. And as we enter this session, we want to reflect upon the day and to have for our speakers to give some of their thoughts about their discussions today. I will do a very brief introduction, but I want our speakers to perhaps just spend a few minutes share their thoughts about our discussions today, and then we'll wrap it up for the day. And for those who had questions for the previous panel members, please feel free to direct those questions to those that may be appropriate as well. I'm excited to have Dr. Tiwari, who's a professor, head of School of Nursing in the University of Hong Kong. She's a nurse, extensive expertise in family violence research, teaching, and advocacy work. She spoke with us a couple of years ago back during our first forum, and we're absolutely delighted to have her back. Dr. Gill Livingston, who you had met earlier from mental health unit at the University College of London, who's a professor of psychiatry. Dr. Podnieks, it's an incredible privilege to have her here from the Ryerson University, conducted multiple national studies, who's the founder of the World Elder Abuse Awareness Day, and she continues to push for the issues of elder abuse internationally. We're delighted to have this panel here today. So without further ado, perhaps, Aggie, you can provide some comments, and then Gill and Dr. Podnieks as well.
I must say it's been a very exciting day for me. In terms of elder abuse research and intervention, I'm a latecomer, if you like. I spent the past 2 decades working on intimate partner violence. And I'm so glad that suddenly I woke up one morning and realized you cannot just look at one person. It really is a family issue. So ever since then, I've been doing a lot of catching up. And today, what I've heard, it just confirmed all that I have picked up along the way. So one thing I have learned in the past 2 decades is to do not reinvent the wheel if I don't have to. And the more I hear, I can hear there's quite a lot of similarities between intimate partner violence and elder abuse. One of them I hear about is reporting. And I do believe the challenge one sees in elder abuse as well as in intimate partner violence. And I don't believe it's just a cultural issue. It's not just the Chinese people are not prepared to talk about it. My husband is Indian. Believe me, Indians don't want to talk about family violence either. So I think the challenge actually is very much is contextual, depending where we find our clients and trying to ask questions. The other one about is the intervention. The more and more now, I'm convinced that there's no one size fits all. Not that it should ever be. But sometimes I think in the design of our intervention, I often ask myself, how much groundwork have we done in order to really understand the problem, the issue? So more work on the biobehavioral reaction, perhaps, to the, whether it's elder abuse or partner violence, that actually lays a very good foundation for intervention. And of course, then it comes to evaluation. How do we know what works? Another issue I've heard today is the social support. And I'm so glad these issues come up. Because in intimate partner violence, we find social support actually so important, and it features in many of the intervention. So I'm not surprised the same actually apply to our elder clients. Of course, I do realize that depending on the needs, then it may vary in terms of how it is operationalized. One thing about social support that we have learned along the way, different people seem to need different social support differently, even though the principles may apply. So some people may prefer, for instance, to have their family member or their friends. Some might prefer people they don't know. And in this respect, I highly recommend our use of the trained peers. One thing we found that we can actually sustain and scale up our intervention is through the whole army of unpaid but highly motivated, totally committed peers in our community, whether it is for the prevention of child abuse, prevention of partner violence, or prevention of elder abuse. Thank you.
Hi, it's been a very interesting day. I've noticed there's a consistency that people seem to have a sort of road to Damascus moment, and they realise things. So whether it's that we're all speaking prose anyway and have been doing it for years, or that intimate violence requires two. I'm thinking about one, isn't it? Or myself, when I realised that these nice nurses that I said hello to in the corridor were abusing people, and we don't know who's doing it, and an abuser looks like you and me, and that really is something that made us all think about. I think what's come across today is that elder abuse is a symptom, and it's very, very different, and it's not all the same, and what paid people are doing in care homes, what families are doing at home, and what's happening to the cognitively intact and what's happening to people with dementia is not the same. And it won't be a one-size-fits-all solution, and we have to really think about what the causes are in different situations. Because it was said to me 6 times, I understand that social support might be a really big thing to help solve it. Because I've done the work, I understand that that there's got to be something important about the fact that it happens much, much more commonly in vulnerable people. And it's been said, the more vulnerabilities that you have, the more commonly it happens. And that we can't just pretend that that's not important. We have to help the families who are looking after vulnerable people. They didn't abuse before, and it's probably that if we help them that they won't abuse again. But we've all got theories, there's not much evidence. I'm hoping you'll soon see our evidence showing the odds ratio of 1/4 when we treat the family carers, that'll be out fairly soon. But we need a bit more evidence. We're all doing it. We're all trying our best to do what seems obvious to help. And I think we mainly think we're helping a bit. But we need an awful lot more evidence about it. So that's what I've got from today.
I've had a hugely rewarding experience. Oh, sorry. I've had a great experience here today, meeting with people that I know and love, and it's just been wonderful being in the midst of all this expertise. I do want to say initially that coming from outside of the United States, I want to express my sorrow over the occurrence in Boston. I think Canada and the United States as a family, and if there's a death in the family, everybody feels sad. There were many Canadians running in the Boston Marathon, and we're all feeling very badly for you. This morning, it was great to hear Kathy giving the opening remarks and showing how the government here in the United States is supporting this issue. I think that's a huge endorsement of how crucial this statement is. We then had a wonderful layout from Dr. Kalash on the global situation and the global attempt to address this issue. Only he can do it so beautifully, and I think we all appreciated having that perspective given to us. And as I heard him speaking, I couldn't help but remember the years ago when he initiated the project called Missing Voices, WHO and INPEA. And if any of you have a chance to revisit that document, most of what's in there are things that we heard today. So everything old really is new again. The cases that are cited there, I saw reflected here today in many instances. It shows the universality of elder abuse, and also provokes us to work more closely internationally and globally, because we have much to share, but also developing countries have an equal amount to share with us. And the more that we can work together in partnership, the sooner we're going to address this issue. Dr. Teester covered conceptual framework and discussed many of the theories, the good, the bad, and the ambiguous in relation to elder abuse. And I'm wondering if it isn't time for us to form a committee and develop our own conceptual framework by taking the best pieces of all these conceptual frameworks that she mentioned this morning, including things like the social determinants of health, human rights, the theory of human rights, and cobble it all into a really solid framework that we will have a big conference and debut the elder abuse concept of theory. Now, many things were talked about today. One thing that I do want to say that I am particularly interested in is involving youth in this problem. In teaching youth, we're teaching their parents and their families. And I think it behooves us to keep them and encourage them to take up this issue. And they've shown that they are well able to do this. And the other thing is, we've talked about a lot about social support. We want to move to social inclusion. Social support can be aided by support groups. It's an easy way to address the issue, and it's also very realistic and doable. And support groups gives you social support. So that's one thing I would like to advocate for. And another thing is to mention the power of networks. It's by talking with each other and by sharing our resources and our tools with not only within our own continents, but within a global reference. And one more thing is the extended use of technology to raise awareness. I think that this way we can get out more of what we can do and encourage others to do it. And again, the youth are the ones that are going to help us with technology because they know all about it. And so I would give a plug for that. Thank you very much.
We would welcome any questions and comments, not only directed towards our panelists here, but for those you wish to previous speaker as well. Yes.